Hey everyone, it's Dr. Morales again, flying solo again. So I have a question of the day, and I think I got this question about 3 times this week, a couple times in one day, and Linda took it, but here's the answer. The question is should I gain weight for BBL? This comes up all the time, especially on forums like Real Self. You see in Facebook, I've seen it as well. So patients who don't have a lot of fat on them and typically are a little bit leaner naturally, some are being told that you should gain weight, or they just think that I should gain weight for a fat transfer. Well, I guess conceptually it makes a little bit of sense. You want to get more fat, right, for surgery. And so what they end up doing is, eat ice cream pretty much all day, or they go to Whataburger or whatever, and they're trying to gain as much weight as possible. And then inevitably at around 3 months after force feeding themselves and trying to gain weight, they feel really bad, or they don't like how they look because they feel heavier. They're just not comfortable at that weight. Very uncomfortable to eat that amount of food to gain weight. Then they have surgery, and yeah, they're able to get a little more fat, and you do the fat transfer surgery, you get a little fuller butt. But guess what happens? They go back to their normal lifestyle and their normal kind of metabolism, and then it goes back to nothing. Well, not nothing, but it goes back to had they just not done that weight gain for a purpose. So you need to understand like your lifestyle and your natural metabolism, and that's kind of what I recommend having a BBL. Is just don't force feed yourself, don't try to lose weight, don't try to gain weight for a BBL. Just do what you normally do, and if you have enough, great. If you don't have enough, then you have to accept the reality that you're going to get a limited amount of supply for the transfer, or you have other options. You have those options for really lean women. I can talk to you more about implants and stuff like that. But that's the reality of it. It's absolutely completely a waste of time to force feed yourself to gain weight for a BBL. And then I've run into situations where women who force feed themselves and they're like, okay, well, I'm just ready to force feed myself. I'm tired of eating. I'm ready for my surgery. Have surgery. But when you do the fat transfer, their body is so tight they can't take as much as I know they want. They want really, really big proportions because they did all this weight gain, but their body physically can't take that much. And that's the stopping point for me for a fat transfer. Is either one, I run out of fat, or two, the body is so tight and the injection is so tight it comes out the same hole. You're done. Your body says, I am done. I am about to explode. That's the stopping point. And I've been in that situation many times where I transfer the fat and I actually don't get to use all the fat that I took out from the patient. But you also get the benefit of taking extra more fat from some of the parts of the body, and they aesthetically look better because you look leaner. It has a prettier silhouette, but looks bigger just because I've kind of sculpted everything out. So that's the answer to the question to should I gain weight for a BBL? The answer is don't do it. Hope you learned something. Thanks for following.